Hi everybody, welcome back to Footsteps to Fertility. My name is Dr. Wanjiro Ndegwa and we're going to be starting off the series of male infertility in this June, which is Men's Health Month. And today I'm going to be talking about what is male infertility. Basically, we need to know what it means so that we can understand then what can be done about it. So keep watching. Today we're going to be talking about male infertility, and we're going to start with what is male infertility. I am strongly against saying infertile unless we know that it is an absolute, but most men have something we call subfertility, which means that they're having difficulty conceiving with their wives or women who have no absolute problem. And when this happens for about a year, then we start to think, okay, we might have a problem. What's wrong with the sperm? Can we have a look and make a diagnosis? So it's estimated that around in the cohort of couples who are struggling to conceive, that about 30% of the cause is from the male component. Another 30% is from the female component alone, and another 30% is from both the couple and the male. And then in 10% of the couples, we have really no idea what is causing the problem. So this makes it quite equal, that the male and the female component of patients who are struggling to conceive is about equal. So men, we also have problems. I tend to see these problems in males more in the hot and arid areas, and I'll explain that later about what could be causing that. For a man, when we're trying to find out what the problem is, it's quite easy. For men, all we need is a semen analysis. So the man has to give us a sample, and we're able to have a look under the microscope in the andrology lab. And what basically we'll be checking for is, firstly, we'll be checking about how much volume is he giving us, because that means a lot in terms of our functions of our prostate gland and other glands within the male reproductive system. Are they working right? We also need to understand, okay, how many sperm are there? Are we getting enough sperm, or are they of a lower volume or a higher volume? Because it could be either way. We also need to look at how are they moving, because sperm are microscopic. They need to move from the birth canal all the way into the fallopian tube of a woman for her to conceive. So we need to be looking at what's the index of the sperm that are moving. And lastly, we also need to look at how do they look. Do they have a head? Do they have a body? Do they have a tail? And are they looking normal in terms of their look? And all those parameters are looked at under the microscope. It doesn't take a long time. And from this, we are able to tell, okay, there's no problem, and well, we need to look for a problem elsewhere, or there is a problem and it needs to be sorted on this front. So for men, it's quite easy. That's the first test, and usually it's very simple to tell what the problem is from that test. There are some times that we need to do more tests. Sometimes we need to do scans, sometimes we need to do hormone tests, sometimes we need to take biopsies from the testes, but the first initial step is to get a semen analysis. I know a lot of men are very worried about this because it touches on the very ego of a man, but I think it's better to know, and know if your problem can be sorted out than not to know. So it's just a word of encouragement that something can be done on most fronts for men. So please get yourself checked. If you're having problems conceiving for 1 year and more, please come with your wife, get yourself checked. Let's know where we stand, because at the end, we all, or most of us, do want to have children. So I hope you learned a lot about male infertility and what it actually means. Our next video in this series will be about what the causes of male infertility are. If you have any queries or questions and would like to know more, feel free to email us or book an appointment with the channels that are on our pages. If you like the video and you want to share it with a friend who you know is struggling, please do. Subscribe to our YouTube channel and watch us on Facebook. This is Dr. Wanjiro Ndegwa, and you're watching Footsteps to Fertility Center. Keep watching.